Our attendance is relatively low. I figured it's either the cold, or everybody's got colds, or everybody found out they're giving me. I don't know what's the issue, but welcome. Sounds like we've got 4 online now?
Yes. Okay. 5 with Mindy.
Okay. So, then they'll let us know if they can't hear. Hopefully.
Yeah. Mm-hmm.
So we have our typical agenda. We'll start off with the welcome introductions, etc., our brainstorming cases. Go through a group discussion of identifying healthcare financial support.
Speak up a little bit.
We'll have a group discussion of identifying healthcare financial resources and try to make sure that all of those are available within the medical home portal, and really get your input on things that we might not have already available. But I think particularly learning about, well, what are the nuances of finding them and using them, so that we can put that information available, make that information more broadly available. And then we're going through an effort to put all of our resources of the month on notice within the portal. So we're going to ask for your input on how to make that the most easily searchable, browsable, so that you can find, oh, gee, I remember hearing about that at this one meeting, but I can't remember when that was, et cetera. How to help you find that, going back to find that later, and then opportunity for more discussion and networking. So we'll start off with welcome again, and when we go through introductions. So I'm going to start out, and speak loudly, just
okay.
towards the phone.
I'm Smoko. I'm from Primary Student Connector Service, and after, well, I may need to announce next month, but my program is pilot, and it may go smaller, but I will keep you updated.
I'm Pat Rowe from Select Health, as Pediatric Nurse Care Manager.
I'm one of the QI coaches, quality improvement coaches from UPIC, and also helping with the UCCCN meetings with Mindy.
I'm Dawn Bentley. I'm also Ashley, also. I'm Heather Carlson, I'm Nurse Care Coordinator for the Integrated Services Program in Austin. Karen Martinez, Care Coordinator, Integrated Services, Salt Lake City. Carolyn Howe, Integrated Services in Salt Lake City.
Walt Torres, Integrated Services, Salt Lake City also.
Eric Christensen, Program Manager for Integrated Services.
Tina Polomeni, Family Voices, Care Center. Kay Haynes with Medical Home Portal Resources. Christina, Care Coordinator for Residency. Liz Wellsner, Partner Celestine. Celestine, Christy, what am I? Care Coordinator.
And I'm Chuck Norland, the Director of the Medical Home Portal.
And
who do we have on the
Yes,
online?
we have Nikki online. She said she has no microphone today, but she's Nikki, an RN, Care Coordinator with BCB Pediatrics. Then we have Amy Spears online. Amy, can you introduce yourself, please? You can, if you don't have a microphone, you can type in. Then we have Donna Harlow online. Donna, can you unmute yourself and introduce yourself?
Sure. I'm Donna Harlow. I'm the case manager for children with special health care needs in San Juan County.
Right, thank you. Carl, can you please unmute yourself and introduce yourself? Then we have Mindy Tula online. She is the director of the Medical Home Portal and also for the UCCCN meetings. Oh, Carl says, hi, I'm a care manager with the University of Utah at HEVA. We have Melinda Tibbles on the phone. Melinda, can you unmute yourself, introduce yourself, please? Oh, Melinda says, I'm also muted today, sorry. She is care coordinator from Utah Valley Pediatrics, Timpanogo's office. And Amy Spears,
She's at the Holiday Clinic in the Mountains, care manager.
care manager at the Holiday Clinic in the Mountains, yes.
We had a few folks join us. Do you want to introduce yourself quickly?
Yeah, my name's McKenna Carlene. I'm the care manager and healthcare advocate for the Southridge Pediatrics. Tricia Young, I'm the care coordinator with Willow Creek.
We got one other person signing in who will have introduced herself.
Hello, Rachel. I'm a parent consultant at the Parent Center who works with Eddie.
Great, thanks. Okay, thank you all for joining us.
Thanks, Amy.
So, one brief announcement. So the previous meeting of the UCCCN, Harmony Music presented about music therapy, and apparently they have some new flyers that should say, not flyers. So if you're interested, contact J.C. Voorhees at that number or those addresses, and we'll put that in the email about the resources of the month, so you can find those flyers if you're interested. This presented a question to us about, and that we'd also welcome your input at any point on this. You know, how much should we be informing, kind of without really promoting, services that are, not in the classic not-for-profit mode. So we've elected in this instance to let you know that you can find more information. But if you have feelings about how we ought to approach such requests, we'd be welcome. We would welcome your input. You have another new person who's joined us. You want to introduce yourself? Great, thanks. And also another
Michelle from Willow Creek.
Great, thank you. Sorry. And then I hope you all are aware of the learning session that's coming up on Friday, March the 23rd. Will take place on the university campus. That is spring break at the university, so the traffic won't be near as bad as it usually is. And the focus will be care coordination, what do families value. So we're going to have two panel discussions, one with clinicians primarily, and one with families, to talk about the different perspectives on what kind of care coordination is useful, what is most valuable, and hopefully get some really good discussion going there. So hopefully you will all attend at that meeting, and spread around others in your practices. We would love to have great attendance, and we really do count on the audience to give us a lot of the information and feedback on that. We'll get another email before too long. So brainstorming time. Who's got a case or a situation you'd like to discuss, or offer ask questions about, or offer something that you've learned about in managing a case? Yes.
Okay, I know that I'm the odd man out from the insurance side of it, but I had an opportunity to overturn a decision that was made years ago on a child that uses indwelling catheters for large volume enemas. And it's because it's the only product out there that will allow the balloon to be inflated long enough for the child to hold the enema and make it be workable. We've spent thousands and thousands of dollars in admitting him for these colonic cleanouts when he gets constipated. And this is he has prune belly syndrome. So it's just been a really tough situation. And so one thing led to another anyway. I got hooked up with this mom, and she was talking to me, and I said, that's just crazy. She said, well, my insurance company won't pay for this. And my insurance company for me is being interpreted as Select Health, okay? So I said, well, that's crazy. So we need to figure out why this is the way it is and what we need to do to fix this. Well, I actually got it overturned, and we now supply and cover under their policy everything that they need that they were paying out of pocket for, and we pay every 3 months on it. And I worked with the office up at the colorectal clinic at Eccles, and I worked with the mom, who was incredibly helpful because she was very articulate, and she knew exactly what she needed, how many of what she needed, what could be reused, what couldn't be reused. And it was fabulous. I mean, I probably saved this family, I don't know, but I'm going to say at least $500 a month out of pocket. So my whole point is, please tell your families to call me and select help, because I'm kicking butt and I am taking names. Okay?
Help us with what has been going on the last few years. I mean, she sounds like she's the kind of person who was trying this off and on or continuously and not getting anybody to listen.
Well, I don't know that they wouldn't listen, but she accepted the answer that because an indwelling urinary catheter was not designed to be used as a rectal catheter.
Off-label use.
Off-label use. That's exactly. And I said, and so I went to our medical director. I said, of course it's off-label use. You don't want it indwelling, but this is why you need it. And she started thinking about it, and she's like, okay, let me give that some thought. So then just the motion. And I just could not accept the answer that we would not cover it because it was off-label use.
It sounds like the finances were a duh, because, one hospitalization would cost more than it would cost you for a year.
Absolutely. And I could pull up those records and I could say, this is what we've spent even in the last 2 years on this child. Why aren't we doing this? The parents are going to come up against hard times. We all do. Why are we doing this? But we will cover everything for colostomies, ileostomies, vesicostomies, whatever ostomy. But we won't do this, which is a very simple procedure, and it keeps this kid healthy and active and participating in a good quality of life, and it makes it simple on the family. It just made sense. So, but it was, part of it was off-label use. The other part of it was, well, the Intermountain Home Health, and I'm not bad-mouthing them.
We won't let it happen.
So, okay, thanks. But their response to it a few years ago was, we just don't make any money from it. Okay, you know what? You just struck a nerve. You should never have said that. I could buy a new car off the salesman and he would own it when he drove off. Don't say things like that don't make any sense. You're making plenty of money off something else. Let's really take a look at the need for the family. Now, I'm not a miracle worker. I can't fix it all, but please tell your families to call me. And tell them they have to be patient and they have to be willing to work with me, but I will go out to bat for them. And I think this was a great example that made me feel really good about what I do.
Great. And the lesson perhaps for folks who don't have you at their insurance company.
Still call their insurance company. Yeah, make them fight for you.
So it sounds like it's a matter of persistence, but also a matter of what kind of information, how the information is presented?
I think a lot of it is how it's presented. But I think the other thing is because I could, after working with the mom on several phone calls, I finally figured out what the right questions to ask that were. Anyway, you get my point. It's I don't know what kind of skill it is, but you just have to learn to ask really probing questions. Don't be afraid to push and say, well, okay, wait a minute, I get this, but I don't get this, or, okay, well, I didn't know that, so tell me about this. And let the moms educate you just as much as we educate them. These moms are on the ball. They know what they're doing. They just need resources, and I think most of them would probably be the best resource for us as care managers, to say, hey, do you do this, do you do that, where can I find this, where can I find that? But it was learning to ask the right questions and then saying, why? Because, we all get mad at our 3-year-olds when they keep saying, but why, Mom? But why, Mom? But I think that is part of questioning the status quo.
Yeah, I see that very much as kind of the role of the care coordinators is to ask a lot of those questions and figure out that background. And then the presentation. So more effective, less effective, just different whether a care coordinator were to call the insurance company versus the parents?
I would eventually like to hook up with the parents. I think because they need to be involved, they need to understand, and because some policies have very, very strict limitations. I can't do anything about that, but what I can do is tell the parents, go to your employer and go to your HR people and say, this is what I need. Is it possible to work with the insurance company to get this? Because I can't change contracts. I can change other things, but when policies are very, very specific. And I find it curious that parents really don't know what kind of insurance they have and what to do with it.
It is sort of a black box. I mean, the language in the policies is hard to understand. And so, yeah, that makes a lot of sense. So the information that was key in this situation was that comparing two potential approaches to this. One, doing it at home, in which case you have to use an off-label device or use a device off-label, but keep it at home. And parents are doing this. It's not some home health is coming out to do this.
Correct.
Home health's involvement was just getting the supplies.
Just getting the supplies.
So here's something that allows the family to be independent, avoid hospitalization. The other way to do it is to have to get hospitalized every time the child needs this, and the costs seem like, on the face of it, they would be dramatically different, one in nobody's favor and one in everybody's favor. So kind of presenting it that way, is that sort of what the crux of it would be from the insurance perspective?
Probably. I don't want to make it be about money, but it has to be about money.
But
That's
there's
the
quality of life to
reality.
be on both
Yeah,
sides, too,
yeah.
and risk of exposure to illness, myriad.
Oh, yeah, and I wrote an entire page to submit the rationale for why we should be doing this and why the past hasn't been working. I mean, sometimes we use drugs for off-label use, okay, all the time. But, it may or may not be covered. We get that. But if there isn't anything else out there, and that was what I had to do, is I had to do my homework and call around and find out, is there anything else that's out there? And the answer is, for this case, no, there is not.
So how much time do you think you put in?
Oh, I bet it 10, 12 hours.
Wow.
Yeah.
A lot of time. Does anybody else have similar situations or wins or losses, where you've tried to advocate for something like this? Been rebuffed?
I don't have another case, but just another thought with this one of just how empowering that probably was for the mom and educational for her moving forward. I mean, this isn't a one-time thing.
You're right.
For this child and stuff, and so she's probably learned some good skills with you, working with you, to be able to, care for her son, you said, right? In the future.
Yeah.
Well, thanks for sharing that. Anybody else have a case you'd like to ask about?
Maybe not the same line. So we have a couple of patients that fortunately have Select Health that has helped us on as well, that where things have not been part of their necessarily their plan, that they have been covered as if they were in network. And so teaching that, I think the key is really just teaching the parents how to advocate for that, and the language to use, and the questions to ask. And then, because I don't mind making those calls for families if they need that help. And I think it's more empowering if the families know how to do it, so that they're not reliant necessarily on us to have to do that, to have, to get it covered. And I've worked with, like I said, with Pat with Select, but I've also worked with other insurances where it really becomes, when you don't have that advocate on the patient side, where it really becomes much more of a fight, and you go through two appeals, you hit that third appeal, and then families are looking at getting attorneys involved. And it's really stressful for them. And if they've gone through the first two appeals alone, without having the language and without having any guidance about what they can ask for, not knowing that, it may not be anybody who has anything to do with pediatrics on the review board. And so they really have no idea how this condition or how this, particular thing affects a pediatric patient and their outcomes. you know, and teaching the patients how to advocate for that is huge, especially in those first two steps before they get that final withdrawal. Or ask, sorry, that I lost my train of thought a little bit. But they can ask for somebody who has pediatric knowledge to review. And so they can advocate for somebody who has knowledge about that condition or, you know, and it's huge.
I think that's a great point, having somebody who has, actual hands-on or, direct experience with the kinds of problems I think can be key. I remember a few decades ago, I was helping out an insurance company as, kind of reviewing these things, and I would get stuff, adults, I have no idea about this, but they expected me to make a decision, so it was really hard. Any other comments or cases you want to discuss? Yeah.
It's not really a comment, kind of wanted to talk about this family that I was working with in the Vernal area. We were working with active reentry and we helped the family get a van. They didn't have any results. They have a 11-year-old boy. He's got to be like close to over 100 pounds in a wheelchair, and just would go to school and home because they didn't have a vehicle to transport him. And he's super heavy. Mom can't carry him anymore. He's a single mom with 3 kids. And working with active reentry, they were able to provide her van with a ramp. And I mean, they have like their freedom, they can just go out and go out as a family and do things together. And I mean, nobody would leave because they just felt that they couldn't include him. So, and they also were able to, usually active reentry will have the family pay the taxes and the registration and the insurance, but because this is a single mom, she's only working part-time, just a few hours a week, they were able to get a whole bunch of donations together and stuff, and they paid for the registration, the 6 months of insurance, and I mean, they just literally handed over the keys.
Wow.
We got there in the pretty time, so.
Well, that sounds great.
Awesome.
And it looks like we have 2 listings for them in Rice, 1 in Vernal, so this is the Vernal office that you
I was actually working with somebody in the Price.
Oh, okay. Great. That sounds like a wonderful program. I've never had any direct contact with that. That's great.
Yeah,
Thanks for
they were
sharing.
really awesome to work with, very understanding, and, obviously very willing to go above and beyond for the family.
Anybody else use that service?
Yeah, we have a family actually asking for a van too, but we haven't been able to find the resource. This is not single mom. The father is going to school full-time and working full-time in Utah County. And then their oldest daughter is a very complicated health with a trach and vent and G2, but she's growing too, so mother's small car cannot fit her wheelchair and all the things. And then they have 2 other students and their car seat, and she said, we are really growing out my car and I cannot put her wheelchair in my car and I need a van.
Okay, so I was working with Louis and Santiago, and he's really awesome to work with, really, he gets back to you, or if you have to leave any messages or anything like that, but he's really easy to work with. Okay. And so what they'll do is they'll put you on a list, because it's not like they have just a whole bunch of vehicles sitting there waiting, they, as they're getting them, they're going down the list. And so you really have to advocate for them and just try to help move above the list. But call him and he'll let you know what the whole process is.
Thank you.
That sounds great. Thank you for sharing.
Probably close to a year. Yeah. But I felt like throughout the year, little more because they were without a vehicle, without money, without, anything. And so I feel like maybe I was advocating a little bit more too for her because of their whole situation. So I feel like if they're really calling, but, advocating for the, the families, then things will get done a little faster.
Okay, great.
Will these guys take a pre-existing van and convert it?
Yes.
Good to know. I have several
Or they'll
kids.
trade.
Oh,
They'll
okay.
trade too.
Okay.
Yeah.
Good to know.
So they're part of the independent living centers, so depending on where the family lives, they'll put them in contact with the one that serves their county. And so what's good about Tony and her advocacy is that keeping that on top, and they're trying to keep families as independent as possible. Unfortunately, if they're in the Salt Lake, Davis, Utah County area, there's a lot of need. So the waiting may be a little bit longer, but having one of you like Tony constantly call and say how this will help them, especially since it's a single mom and such. But they are amazing at some of the things they can do, but their funding unfortunately is limited depending on the legislative year.
So they're state funded?
They do get some state funding.
But that's not all of it. Okay, great. Thank you all very much. Anybody else have anything?
I just wanted to let everyone know, I was reviewing primary students' emergency department visit, and then we found out so many of our patients are coming for the feeding tube or feeding, like a G-tube button issue, and then most of the time, and I did call some of the PCP office, and they said, yes, we do not deal with feeding tube issues or buttons, and we just tell them to go to ED, primary students emergency. And so we are in the process of creating feeding clinics that would open 24/7 almost for any patient. Instead of going to ED, that they can come to feeding clinic. It's not starting yet, but also right now, if the patients are coming to comprehensive care clinic, they have a 24/7 access number to call, either during the day to me or to the comprehensive clinic care coordinator nurse, and after hour for comprehensive care onco provider, PA or NP would answer, and they will tell where to come to primary student, not to go ED, but we'll deal with your button, or we'll deal with your NJ or NC. So just to let you know.
So there'll be a little offside,
Yes.
off the ER?
Yeah.
So that raises an interesting question. For those of you in primary care practices, do you have any sense of how comfortable your clinicians are with things like, G buttons that are popped out, that sort of thing?
Not comfortable. I mean,
Not.
actually, I was in the back because I had, a pre-garage bed for quite a few months, and I was sitting in the back, and all the dogs were stationed there that had NG tube, and all the dogs were like, what? It was really hilarious to watch, like, you just take it out. Well, I haven't ever placed one. You just stick it in, hook it on things for down here that are important. Like,
There's not much you're gonna get.
That's what I got told when I learned how to do it, But yeah, I mean, not comfortable at all. It's just frightening. That's why they go to the emergency.
But, we will have that clinic open soon. We are in the process. And in the meantime, you're welcome to contact my office. And if your patient goes to comprehensive clinic, that's where they can call anytime. And also what I noticed was some parents are brave enough because they go to G-tube class before discharge and they know how to inflate the balloon and everything, but they use the emergency button, and then their emergency kit is not anymore emergency kit. And when they need another one or something get that's a rare type we don't carry all the time. It takes a week to get it. So just go to primary children's emergency. So I found out all those things. I was calling insurance and also I was calling home care to at least keep in stock one or two of them if it's a rare size, and also telling family if you ever use the emergency kit, contact me and then I will contact your insurance because it's cheaper than coming to ED.
Yeah, and so how often would the ER have such a visit? Are we talking about 30 times a month, 10 times a month?
Maybe 10 times a month, but in fact, well, I'm looking right now with the only complex kid, and I still see some, even though I tell them, they may forget, so I am consistently telling them to call me before, if it's just a simple G-tube or NJ issue. But NJ, you have to come anyway to our facility for fluoroscopy process, but.
Interesting. Yeah, I guess one thing in the back of my mind, would it make sense to try to train pediatricians how to do this? But, there's 360 some general pediatricians in the state. That would be a lot of people to try to train for something that happens once every 3 or 4 days.
Yeah. I asked you that question. Did you get that training?
I sort of trained myself.
Me too.
Right. So, I mean, certainly, so residency has changed. I mean, we were a lot more hands-on. We were doing everything, all that sort of stuff. Yeah, currently residents, and that's probably for the benefit of the kids. The residents don't learn on the kids, which is how we used to do it. So I think a lot of people do come out of residency even without a whole lot of experience, and then to go into private practice, there's almost no demand for that, and nobody to teach you if there was. So I think it is a problem. So for something of the scale of 10 times a month, having one central place might make sense, but of course, primary children's isn't exactly close to all the patients, so it's not terribly convenient. But this sounds like a better thing than the emergency room. So thank you for letting us know.
So I have a question. If any clinic support class was interested, or support staff, I don't have a brain this morning. I really apologize.
So have Liz interpret for you.
Yeah, I know, I need more coffee.
We have lowered expectations at 10 o'clock.
That's not my day. Anyway, but if any of the clinic support staff was interested in learning more about G-tube care, is that available? I know we've had staff express interest, and we just haven't really looked into it that much.
I can bring it up to our hospital because we do G-tube class all the time, because we have always every week new G-tube placement, and we teach the parents, so that class can be open. Let me go back and ask, because most of the time in our hospital, doctors don't place the NG or anything. Nurse, we do, and we teach the family too, but let me find out if we could make it to open to community nurses or care coordinators, and I will get back with Mindy or
Mindy says there is information on the portal about feeding tubes.
Right.
So
we do have a page in the for physicians section on feeding tubes. But I think this is more kind of the practical stuff that may not be that addressed that detailed, but this page on feeding tubes and gastrostomies does give an overview of that, and it may be helpful.
yeah, she said it might be helping families to avoid having them come out as often.
Right.
So,
Okay, great. Any other comments or questions? That's very, very useful discussion. Thank you. So does anybody have any motivational interviewing opportunities that you've taken advantage of that you'd like to share, or quality improvement wins in your practice? See, Seeing no hands. Anybody online who got offering something?
Not a point,
No.
no.
Okay. So what we'd like to do is to spend a little bit of time learning from you what kinds of financial supports for families you found that are useful and helpful. So, as you, I hope you're all aware, on the portal in the services directory, we have two sections that talk about financial assistance. So, one is financial, labeled so. So it's got a bunch of specific kinds of support, and then we also have under, and then medical expense assistance. And we're always anxious to, or eager to hear from you if our categorization doesn't work well, or organization, we can move that around. So this is more specifically focused on medical expenses. And then we've been putting some effort, Kay, particularly in kind of cleaning these up recently. So if you could think out loud for us about financial assistance programs or needs that you've managed recently or not so recently that you'd like to share with us, your problems you've run into that you might get some more feedback on. Tony?
So I don't see is the HEAT program on there?
HEAT program?
Yeah.
So,
That's,
let's see.
does everybody know that?
Kay, do you know where that would be?
It is in there. It is in there. Okay. The Zillion records. And then all over the state. Jewish services. They helped one of my clients with 2-night stay at a hotel. And they didn't require any, I mean, I just called and said, I have a family that has this, and they did everything over the phone.
And that was Jewish
Services.
Services?
Tell me, where were they based out of? Were they Salt Lake?
Jewish community center.
You've got the Jewish community there. Jewish Family Services? Is that it?
Yeah.
Okay.
Yeah, they were, they will help up to $300.
Okay.
So,
And they would do that statewide?
yeah,
Okay.
and for anybody, so.
Well, so you just have to call, say, I've got this need.
Yeah, I spoke with Kathy, she was super nice.
Do you know if they've got any criteria that family has to meet?
No, I just called and just told them what was the situation, and they just kind of made a decision over the phone right there and then, so I think, So they did it for a family often? They were in the, they had.
That's great. Okay. But what other maybe unique or problematic situations or services have you found related to financial assistance?
I'm sure you probably have the United Healthcare Children's Foundation on there. They'll do up to about $5,000 per year. There are financial guidelines, so like a family of 5 can't make more than $125,000 to apply. But they help with not past medical expenses, so if they have medical bills from like a year ago or something like that, they don't help with that. But if so I help the family apply for a cochlear implant, if their insurance will deny, they don't take Medicaid at all, but they do work with insurance, and you can get a denial from the insurance company for something like a cochlear implant or some kind of assistive device or some kind of medical procedure that your insurance is only going to cover a portion of it, and you need help to get the rest of it covered. United Healthcare Children's Foundation. It's just really easy. The website is so nice and so easy to navigate.
Barely hear that.
So it's not just for United
No.
Healthcare.
No.
You have to have some kind of commercial insurance in order to qualify. And it also, from reading this website, indicated needed therapies that have been denied. I don't know of anybody that's applied and gotten it, but there is a doctor's form that needs to be filled out. out.
Yeah.
But if they, you know, if the insurance copay is so high, that they will pay, but they have to pay the provider. They don't pay the them. So,
Oh, okay.
from what I've
So
read.
the provider has to bill them, or, you know?
They have to get estimates of like the cost, like what, you know, what are you actually looking for? Like for instance, again, the cochlear implant, like this is how much money it's going to cost. This is how much insurance that they're gonna pay. You have to support it with that information. And say we're looking for assistance of, you know, $3,500 to cover this amount, and then it goes directly to, so you have to have your supportive document, and then they will pay the, you know, the physician or the provider of the implant or, you know, what have you. So,
I'm just curious on that. I have a family that I'm dealing with cochlear implants right now, and she lost her hearing because of meningitis, antibiotic toxicity. So, she didn't have a problem getting the implants, it's the batteries. So would something like this work? Because they have to replace the batteries every 12 to 18 months, and each battery is $500.
Yeah, I think it would count as, medical.
Current medical.
Yeah,
Mm-hmm.
so I would definitely call them and try. They do have a nice, when you go on it, it says apply for grant, and it says eligibility, and I'm not eligible. So it's just really easy to go check and see if there's anything listed that will give you some clarity one way or the other.
Website's pretty good.
Yeah, it is, and then if not, you could call. That there's also, where's the family?
Here in Salt Lake,
Okay.
Salt Lake County.
Angel Hands might help them as well. And they're a little tricky, but, they won't, what I found with Angel Hands is they really won't talk with you until you do the registration. That family has got to register first, and it's an easy form. But if you try to make phone calls and stuff, I have not had success getting them to talk with you until that registration form is filled out. And then you can apply. So it's a two-step process, but that's something that they might help with. And the Weaver School Foundation in Ogden would use something like that, the batteries. So I don't know if you have that kind of foundation in the Salt Lake area. Weaver School Foundation helps us with iPads to companion dogs, to all of that kind of stuff in the Ogden area. And so, yeah, they're just like the Weaver School Foundation, and the Ogden district has one as well. So I don't know if the school that this child is going to, if they have a foundation. I don't know if we have something in the area to find, but that's something that they would do. And I've just written letters for the Weaver School Foundation, you know, a letter
I
of
just did a
support.
really quick search, I just pulled up Reliant Education Foundation.
Okay.
And it just help us provide resources that create opportunities for success. So we provide grant schools to students access to resources that improve educational outcomes. So it might be interesting to check the local Jordan County grant, Tier 1 Wasatch Front, to see if they have such a thing.
That's great, because it looks like we don't have that. Does that ring a bell to you?
Granite does. Yes, we do have resources.
Really?
Yeah.
Search didn't find it.
But it's Weaver
So
School.
we've got Davis Education Foundation. So it sounds like there's a bunch of those around for different school districts.
The Ogden School District has one as well. And they've been so wonderful to work with, so wonderful. Like client and iPad, an undocumented child that has, you know, severe disabilities, but because they're undocumented, no one else would help them, but the Weaver School Foundation helped get the iPad and got a non-breakable case for it and things like that, when he threw it, he didn't make it. And then another one of our kiddos, his dog got run over and was killed, and so they applied to the Weaver School Foundation and just wrote a letter for him, and the Weaver School Foundation from the companion dog. They've been really wonderful to work with, so maybe you'll find the same in your community.
You know, I think the key to all of this too is to say anything that improves educational outcome. I think that's kind of the key.
Exactly, and this dog is a companion for Tucker at school. And then they let them, you know, have them at home.
quick search, we kind of went for sub-8 with that, so I think everybody. Okay, I don't want to generalize that. Anyway, some of the big players, we found some.
There's more than one, right?
They usually meet monthly, and you just put in your application, the family fills out their portion, and then they need someone to, to advocate for them on their behalf and write a letter, a medical professional or a teacher, what have you, and then they review them every month and make a decision.
Is the application online?
For the Weaver School Foundation one, yeah. And so, of course, it's just in that area that, and that's so easy.
Great.
And then I think they have Able differently this year, right? Okay. That one's great, but that one helped us get guitar lessons for a kiddo that was wanting to kill himself up in Bernal. He was suicidal, and the only thing he really found joyful was playing the guitar. So we applied to Able differently, and they paid for guitar lessons for him. And of course, they have to participate. The family has to participate, kind of write down, how they're doing before these services start. And then they pay for the guitar lessons, and then they check in regularly with the family and, see how it makes a difference and everything. So they really do that as well. And that's an easy application.
Great.
Not for all over.
Sounds like some super resources. Anybody else have one that you've got some experience with, or situations that you've not found good resources for?
Reliant.
I'm sorry?
Reliant.
Reliant?
Reliant. They'll help families when they're.
Reliant?
Reliant. They'll help families when, we had a little guy who just passed away, but during the time of crisis, they'll help with, bill gas, groceries, transportation, and funeral costs. That has gone away.
Still there?
The board of primaries, for example, it's specifically designed for end of life, so that, but it's been. Rachel Pike is the county dealt with.
That's the person at Reliance?
Mm-hmm. Okay. She's in charge of getting all the information back to the people that, would be paying for stuff. Her, do you want to go number? Yep. 801, 808, 1374.
All of this information will be in your resources of the month, so you don't have to scramble to write it down.
Has anybody used the GIA Foundation, GIA, or the Steelman Foundation? I have, Dusty, you know about those? What's that?
Stillman we've used, we had a patient, that lived in eastern Summit County that needed, a wheelchair accessible van, and Stillman Foundation helped with that.
Nice.
Yeah.
I forget, is it the Steelman or the GIA? One of them is like very specific in their mission statement about helping single mothers and with handicap, special needs children.
I don't think that, unless Stillman changed their mission in the past year, it wasn't Stillman.
Okay, that must, so it's STEALMAN, right? Steelman.
I think it's STEEL.
Yes, it's good. They're out of Portland?
It's a regional.
It looks like, I couldn't find GIA, is that?
GIA?
Yeah. Doesn't, we don't have that, so we'll look into that.
What do you use GIA for?
I think, I just recently got wind of it, but I think this one is designed for single mothers with complex children, but.
So the GIA All-in-One Foundation?
I think that's it.
That looks familiar?
No, it doesn't. But then again, I don't spend a lot of time, and I just recently got wind of that one.
Looks like it's interested in support of suicide. Okay, well, we'll certainly look into this and add what we learn on the resources of the month. Anybody else? See me live. So a key question, I think one of the things that's driving our interest in this is how to help you find resources when you need them. So, you know, most of these we could search and find, but you had to sort of know the name to find it. How many have had frustrating experiences using the portal to try to find resources? And what might you have learned in that process that could help us organize things better?
It's okay to say you have.
No hard feelings.
I wonder if, you would actually use the service in a short description of how it helps you and what your experience was, and that way you know if you're getting yourself into, you know, if you're just wasting a bunch of time, or actually somebody used it and it was very helpful, and it was quick, and it, you know, so like a ratings or a,
Okay. That's interesting.
comment, on our, experiences, user rating.
So being able to, when you use one, you know, either you think, okay, well, I should help other people by coming to the portal and adding that, or if you found it, searching the portal, oh yeah, I've used this before, I can offer some comments. It's an interesting suggestion. Yeah, and we've talked about that, sort of about that a few times, but our conversations have usually been around clinicians, you know, subspecialists and that sort of thing, where I'm not sure we want to go there because, you know, those comments can be hard, but, you know, the university several years ago started publishing the comments that they get back on their customer surveys or, you know, patient surveys, and now it's spreading all over the country in terms of sharing those. I think they edit out the inflammatory ones,
Right.
but still, those might be useful. That would be interesting.
So when I search for things, usually it's on the fly, I'm trying to do it quick.
Right.
And so if I'm looking for a family that needs funding for, I don't know, something that might help pay for therapies, right? So search terms that I can use that are, you know, funding for therapies or funding for equipment, you know, just really general that will pop up those funding providers that in general address that category. Does that make sense?
Right.
Because then I get a list and I can be like, okay, so we've got a little bit of work ahead of us. I'm not having to search through the whole list. They go through each website, what they'll cover, what they won't. In general, I know, yeah, this one helps with equipment. This one helps with medical expenses, you know, different things like that that make it quicker and reduce the amount of work I have to do.
Right. So you'd be thinking that ideally we'd have something, it'll come up here in a second now, that might be a little more granular than the subcategories here?
Or even in your search engine, if you had
Yeah,
like
in
a
the
more
search engine,
specific,
sure.
like you could narrow the search, yeah, like it.
Yeah, I
So
think,
that's good,
yeah.
it might narrow that down.
Okay. And then would there be other criteria, like, you know, with insurance, without insurance, and those sorts of things too?
Yeah, like, searching for a house.
That'd be
We're
great.
not just looking for houses in the area,
Right.
looking for houses with many bedrooms, with many bathrooms. For instance, if you search hearing loss or hearing assistance or hearing technologies, it's going to pull up, typically in the past, it's going to pull up most audiologists and ENTs in the area. That's not helpful. I'm looking for a foundation that will write hearing aids, or I'm looking for someone who would give aid or financial help for cochlear implants. I don't necessarily need every provider who sees their services
Right.
hearing patients, you know? So if there was categories, I definitely am in the right place though, right? I definitely want those people, but then if I could, okay, great, now out of those people, who actually offers financial assistance versus services for those? If you do services, it's everyone who serves those people in any capacity. So subtopics would be.
So, just trying to think through the practicality of that. So that sounds like kind of sort of an advanced search function, where we would have perhaps, I mean,
But I realize it gets super complicated in websites.
well, it does, but that's doable. I mean, that's just meant programming, right? Then making it usable is the other challenge, and having people actually use it. So, is that the kind of thing you're thinking about? It's sort of an advanced search, because that's the only way I can imagine us being able to operationalize that. Okay, I want you to limit me to financial assistance, and then I want to say what kind of assistance.
Yeah.
That's what I mean. Okay.
So, and which I totally agree with everything. That's exactly why I was driving at, because when I use the portal, I want to use it like Google, right? So I just want to type in what I need. But if I know that I have to use an advanced search, I'm comfortable enough with using those because I have other places I have to use that would be great, because then I could dial down exactly if I'm looking for funding. But what if I am looking for a service provider? Then I can put in hearing loss and select service provider, you know, or whatever. But I never go to a service directory like this. I use it like a Google search, just because that's what we do anymore.
Right. Yeah, that's what the feedback we've gotten from virtually everybody we've asked is just go to search.
Yeah.
Because, you know, you've got 270 categories here. I don't have time to scroll through because I don't necessarily know what they mean. So we do actually have sort of an advanced search. So this middle category called service category, if you start typing, then it brings up the various relevant categories for what you've got. So if you, for example, say financial assistance, you know, let's see, well, you're good. So we were talking about housing. So I guess what I'm wondering is this too granular or too narrowing? Because if you pick the wrong one, then you might not find it. So do we need to have the parent categories as choosable? You know, for example, well, other. So if you said other and then transportation, what would you get? So there, you know, limits the search, but you know, by your constraints, so you might not find everything. So maybe we need to say, okay, well, financial assistance, you know, the parent category can be selected, and that would be able to search, but not maybe too much. But is that the sort of thing that you'd find useful in advanced search? Would anybody use it? Yeah.
I was thinking, similar to the Google search, but it's more of an Amazon shopping. Like in filters. Like when you put in one generic thing, but then you can, you know, choose a color or size or, you know, whatever, and narrow it down that way rather than me having to add more words than the option
So
we were
that's specific to the topic that comes up, like a personalized
mean, which might be more complicated with the programming part, but,
It would be.
And I like that comment, adding more words, because watching you do that, I'm like, oh, that makes sense, that's how I would find it. I would never come up with those words that you just typed, I would never sit down and be like, what should I search, and type that out. For me, it needs to be a list that's there for me, like a filters option, where I'm not actually having to come up with the words that have to be entered.
Okay, so there would be a list of narrowing words kind of thing that you could select from and say, okay, you know, keep these in, keep these, fix these out. Okay.
well, and having a short list like that can prompt you to know, oh, yeah, that actually is exactly what I want.
Right,
It's not
Right,
coming up with that in the underground.
right. Like, when I see it, I'm like, oh, yeah, but if I had to spontaneously type that in and come up with it off my head, I mean, after practice, I may know what I'm searching for, which maybe it just could be more training, but for people who aren't as, like, I'm looking typically on the medical home portal for very specific things over and over again. People who are working in more general practices aren't necessarily looking for the same things, they're popping up with different cases all the time, so to memorize all these specific verbiages, I can imagine it's difficult.
Right, okay, that's very helpful. What about others? Similar experiences or experiences on other sites where you look for stuff that, you know, you find things that are useful that you might try to emulate?
I'm just going to suggest, though, the use of creating, as care coordinator, create your list. My problem is I'll find something and I can't remember how I got there. So if you're logged in and you find something, save it, create various lists for various topics. That helps you to stay organized within the system. And it's kind of a workaround right now. I think advanced search features will be great because I'm an absolute idiot and I can't remember from time to time what I type in. So advanced search eventually would be great, but if right now when you find something, you can throw it on your list, then it's there the next time you're looking for it. So I do that.
Yeah, we talked about the list functions a few times. I'm not, does anybody here use the list?
Your question, is there a tutorial on how to create a website? I need a
step-by-step
kind of deal. A tutorial for creating a list on the website there is?
No, there is not yet. No.
Well, Debbie has created something that she can say. Okay, she probably has, I think. Have you, Mindy?
So, Mindy, can you answer the question? Where could somebody get a tutorial on how to use the list?
Good question.
Sounds like that's the next thing on her chapter. So we recognize a number of deficiencies with the way lists are done now. So we are going to be working on improving that, but probably creating a tutorial that could be used in the meantime. And would that tutorial ideally be a video, or would that be a written document?
Well, I was just saying, if there was a spot right there by list where click right here, and there's Mindy in living color at the Wurlitzer typing this all in, showing me how to do it. You know, might be, sorry, Mindy, I'm throwing you under the bus.
Yes.
But, you know, something like that is really helpful visually, you know, the YouTube link or however it works to kind of show you how to do it.
Okay, so would it be best to do a YouTube, best to do a written document, or best to do both because people would vary? Both?
Yeah, people do vary.
Yes. We do.
So Minnie says she thinks she has a step somewhere, but not a video. And after Eric spoke, she says, yes, I can do that.
Okay, so we will do that and let you know.
Yeah, yeah.
We will do that and let you know. Okay. Another question that we come up with frequently is around cities or locations. You know, we find that there are lots of, you know, many times or not infrequently, you know, a program has a physical location that we enter, but it really serves statewide, or it serves these 3 counties, or that sort of stuff. We do have a section in each of the entries that talks about, well, the geographic area served. Would that be one of the things that you'd want to have limited in your search? Is, okay, I only want stuff that's relevant for where this patient lives. That would be important.
find is sometimes when somebody's office is like listed in Harriman, then if they serve Salt Lake or they serve Utah County, it's confusing to have them listed in a particular small spot. Like if it was Salt Lake Valley or Wasatch Front or something like that, rather than Harriman or Draper or Lehigh or, I think that's too specific when they probably cover the service in a lot broader area.
Right.
And you're not thinking to look in a particular, excuse me, that they would serve Salt Lake, but you're looking in Lehigh.
Right, right. So would it make sense that, okay, if it's a place where you have to go to get your service, like it's a physician's office, then it makes sense to list the location, because
Yeah.
physicians would serve anybody who showed up, right? Whereas if it's a service that doesn't require you to go there, then you list where they serve.
For one example, when I was looking at speech therapist, their service is to provide therapy in 4 locations. They will go out to Draper or South Jordan or Harriman or whatever, but it might be that the person actually lives in Harriman.
Right.
So you'd have to go, but they're all close enough that you would say, oh yeah, I would go there. But some of them, like you said, the provider might only have an office in one location, but then autism services may cover the whole southern half of Utah or certain counties. But yet their office is in Lakewood, but they serve Weaver County as well.
So in our listings, let's go back.
But you know, Marilyn, sometimes that can be confusing. So, for example, like
Yeah.
think about Kids on the Move. Well, for their EI, they're only doing that specific area, but for the autism services, they go all over the place.
Right.
So it kind of
So what
depends
do you
on
do?
what is the, the organization, and do they offer more things. I'm thinking also like at Janet Wade, her group, Easter Sills, and with Provo Early Education Program. Well, that's an EI program, but they also serve young adults as well through another program. DDI Advantage is another one where they have an adult program as well. And so, sometimes those services, depending on whether you're looking at infants or whether you're looking at young adults, could be a much broader area than, say, the school district-specific services for EI. It gets a little bit complicated.
Yeah, it's complicated.
Yeah.
So, just to get back to your specific situation, so if you're searching by category, then you get this list that shows, cities. These are primarily by where the office is located. So like we've got one in Boston, one in Virginia, Oregon. But if we had one, 4 counties, would you want? Yeah. Okay, I hear your point. Not sure how to
Our search
operate.
would bring up offices located in Harriman. But yeah, search Utah County, Salt Lake County.
Right, yeah.
Juab County.
So like Kids on the Move, their offices in Orem, but yet they've got services down in St. George or Landing or wherever, only for the autism program, but not for their other programs. Yeah.
Okay, great. That's very helpful. Gives us a lot of ideas and challenges to just try to address. Any other financial assistance programs or anything?
I got one.
Yeah.
I don't know how helpful this will be to you guys, but, my other job is I, help run a local pediatric cancer foundation. So we help provide money and, obviously for financial assistance and sometimes funeral services for that. No parent has to pay for every other child. So that's one of the things we cover. It's called Millie's Princess Foundation.
Millie?
Mm-hmm. And, you can contact me if you want, if you have any patients that are in need of financial assistance.
Millie's like that?
Yes.
Okay, sounds like one we don't put. That's because I have that service category in there.
Yeah, what was the name of it again? Millie's Princess Foundation?
Like it's not in there.
they just, do they just help with the, end of life costs, or
No,
are there things they do?
all, Brainstorming is just for anything.
Okay.
It seems like, funeral costs has been a growing need, unfortunately.
Some foundations cover certain diagnoses.
Any pediatric cancer, and we cover childhood cancer, it's intermountain, so any intermountain west, so that much necessarily be in Utah, but treated at primary children. And
We do have a couple of foundations that cover cancer, but we don't have
Oh, really?
one for medically complex kids.
I know, it's so much harder.
That looks great. I love it because cancer is royalty.
Yeah.
Okay, great, thank you for sharing that.
So, there's also another one that's called Children in the Earth, and, I think we haven't seen that. But they are, they help with cancer, they help with rare disease, and try to, help with either medical costs or wishes, for kids in Utah. I love Children in the Earth, but the parents should be aware that they are required to help fundraise, and they do keep some of the money. So, yeah, that's good. Yeah, and they do some wonderful fundraising, and, even though they only take on a few of the bigger, financial assistance pieces for a few kids, they also have volunteers that anybody that's on their list, like, so for Valentine's, they'll do these heart attacks, which means they'll run out to all the homes and give them Valentine's for the whole family. They try to really look at the whole family support. And yes, they're limited based on how many they get, but they have done some phenomenal things, including paying for funeral costs for those that don't have cancer.
Okay, great, thank you very much.
Do you have mascot miracles on there too? I don't know how big their budget is, but they might be able to help with that. Another great one as well.
Mascot like that?
Yeah.
Nope.
I'm taking notes of your mascot, what was it again?
Or Miracle. I think it's Melissa Hill is still their contact. I can.
Great.
Chuck?
Helps us a lot.
So we have about 50 minutes left in the meeting, and we still need to cover the Resource of the Month PDF question.
Yeah.
So, being the timekeeper. Yeah.
Okay, anybody else?
That's what makes it
Okay, thank you, that's very helpful, and I really do appreciate your input on the portal and how to search or not search, and any other ideas that come up, please feel free to email us. Yeah, I can't promise quick turnaround because programming is slow and we've got a bunch of things in our programming queue, but we will be working to make that better. So we talked about that. So, resources of the month. So, we've gotten feedback that a lot of people really like the emails, the resources of the month. Some people kind of archive them so they can go back and find them. And we've started to compile those actually on one page of the portal, or a link to the individual PDF versions of those. So we're interested in making that as ideally searchable as possible. In general, if you were to look at a list, so if you had a page that had the essential information that would then connect you to a PDF of that message, would you browse that list, or would you do a command find and search that page? Which do you all have kind of stock modes of doing that?
I usually would browse first. I mean, I just run my eyes down and see if what I'm thinking is going to match with what I'm thinking.
And do you think of it mostly as, well, I can't remember anything about this except it was the same day as we had this presentation, or how would you remember it best? Do you think?
I don't know if this helps at all, because
Can you speak up to?
oh,
Yeah,
I don't
yeah.
know if this helps at all. My brain doesn't work in a computer form. It's too fuzzy, I guess. But it's what I have done is try to set up for my colleagues the opportunity to find the things that I learned here. So I have put them on a shared drive at work. And if the meeting talks about resources for financial resources, I have categories of financial resources, so I'll put that document in that file. If we also talk about autism, then I have a category for autism, and I will put the same document in the autism file.
Okay.
So it may be filed in several different areas. I don't know how else to do it, but that's just what I have done to try and offer my colleagues.
And how many different categories do you have?
Not enough yet to make it as simple as possible.
Okay.
But again, I'm doing this on the fly like
Right,
everybody
right,
else is trying to do something. We have the same thing for Intermountain Medical Group for pediatrics.
Okay.
The problem is sometimes it's time-consuming to update and getting all the relevant information. I've also, for myself, put everything we get from here, anything valid in OneNote. So maybe it's not relevant at the time, but I know that we've talked about it, and go back, find it, and then I can access it and use it. So combining the two has helped.
And I'm sorry, you have also categories of?
Yeah.
And how many categories do you have?
I would say about 15.
Okay.
15, 20. Because we even break it down to, like, for mental health, what insurances cover what providers, which is that's an ever-evolving situation.
Dusty?
I'm just going to share my less efficient way of doing this. I archive the emails, and I'm like, oh, you know what, last summer, I remember we were talking about whatever, and I'll go look through the 3 emails or 4 emails that kind of cover the time frame that I'm going to see.
That's what I do, Jessica. I feel like you. That's what I do.
I operate in a parallel reality sometimes, and so what I think was only a couple months ago turns out it was like 9 or 10 months ago.
Yeah.
Sometimes, my perspective is really wonky.
Yeah.
So I admire that you can pinpoint it to just a few months, because I'm
Well,
not.
I think seasonally, summer, spring.
Okay, well, that's very helpful. So we've kind of mocked up 2 different formats for how to present those. So let me just take a couple of minutes and ask for your feedback. So this is format 1, where they're organized by year and then by date. We have the presentation listed, and then the case. So this conceivably could be browsed, kind of as you do by date. Okay, well, let me go back to that general date. Even for Eric, he could find 2 years' worth on the same page. And then the other approach would be more in a table format, like this. So here, again, it talks about the cases and the specific presenter format. Do you have a preference between those two? I'll go back to number 1, so I'll let you look at this for a second. So the date on the left-hand side, and there's the cases on the right, and this is more splitting it out. Does it matter?
I feel like this is a lot easier to read. Yeah.
Okay.
The one thing I like about this is it lists the presenter, which the other one didn't list the presenter.
It actually did.
It did?
But it's just a little bit harder to read.
If it was under the month,
Right.
and
right?
If it were bold, I didn't even see it. You could barely make it out there. See, it's Cases, and then somewhere in there, it says, it'll take you there.
I like the way
So this is generally preferred?
Yeah.
Okay. Get a lot of head nods. Okay. That was very helpful. So we will endeavor to move forward on this. So we'll let you know when this is ready and live on the portal. Actually, I think it's live now. So where to find this? So if you go to the for physicians and professionals section, care coordination and portal partner states, and then down to Utah Children's Care Coordination, and then to resources of the month, that'll get you to this format.
So Minnie writes, the cases have no care coordinator names on them on the web page, but the care coordinator who mentioned them is referred to by name in a PDF, which should get indexed by search engines so people could search for care coordinators' names.
Right. So I don't know if you all heard that, but you know, on the web page we are not going to name any names. But on the, as you know, on the resources of my emails, it does say, you know, who brought up something. So you can search for yourself, or you can search for, you know, if you remember who it was. Then if you do, once this has a chance to be indexed by Google, then if you just search the site for that name, it should bring up those PDF documents that have that person's name.
And Minnie's asking if that is okay with our members.
Anybody object to that? Okay. Thank you very much. That's immensely helpful. Oh yeah, and then so the other thing, of course, you know, that so we're just talking about the browsing format. If you use Control F on that page, then that can help you find what you're looking for. Anything else? Okay. Don't forget your validation.
And if you haven't signed in, please sign in, because this helps us with the documentation of the validations as well.
And then we won't have this meeting next month. It'll be replaced by the learning session, so please attend the learning session. That's on Friday, March 23rd. And have a great day.
Great, thank you.